Hey guys, Don here. Welcome to the Minute. We're going to go over the things that help to practice get to the $1,000,000 mark and beyond. I always like to share kind of what I'm listening to and kind of doing in practice in my life. I was really, it was kind of uncomfortable sharing my goals with everyone. There was a podcast yesterday which was pretty much my goals for this quarter. I didn't realize how hard it would be to be vocal about that. I think it's something that we tend to keep tight to our chest, and but I think it's good to write out goals, and I think by doing that, I dictated them or I read them out aloud for you, but also for me to listen to them once a day to kind of see if that'll help it. I've heard about doing that. I've never really personally done that, but I'm going to be trying that. So that was kind of an uncomfortable thing. Another kind of thing that's been going on, uncomfortable. My dad, we finally got most of his paperwork done, and now he's going to be going to a adult daycare. He's dealing with some dementia. We saw finally a geriatrician, and we saw a geriatric psychiatrist, and now we're going to be seeing a neurologist. So I tell you, it's a long road when dealing with like this dementia, Alzheimer's stuff. But I'm hoping this day program will be good. It's right close to my house, so I think it'll give a little bit of break for us. What I'm reading right now is I'm reading a book called Go for No. If you've never heard of it, it's a good book. It's written more on a story format, and it tells a story of a guy that falls, hurts his head, and he kind of goes forward 10 years in times and sees his future self. There's kind of an idea about like your future self and how this person was more successful than the current self. And the main difference is they tried, instead of tracking the number of yeses, they tracked the number of no's. And this is something that's kind of neat. In practice, for example, there's certain things. I know we don't think of ourselves as salespeople, but we're all day long we're offering and recommending things. And sometimes we neglect to offer to patients these things. And if you never offer, they never can say yes. So I think even something is, instead of going for like, okay, my goal is 2 orthotics per day, my goal alternatively could be going for 10 no's, 2 orthotics. And I think you'd get a lot better that way. Okay, let's go into the day. It was 19 patients. I had an hour openings during the day where there were no patients. Actually, another plus before I go on, I got my results from last month, and I had 26 orthotics. I've never done 26 orthotics before, so that's about an additional 13,000, probably more than 13,000, probably 14 or 15,000 on my number for the month. I'm usually around 11 or 13, and mind you, all of mine are self-pay. There's none that are covered by insurance, so it's a little bit harder. But my goal each day has been 2 orthotics, so maybe it should be saying no to 10 orthotics. But 2 orthotics a day if I'm working 20 days a week, or a month, and that would be 40 orthotics. That would be ideal. I'm not up there. I'm at 26. Okay, first patient was a Cariflex. She had a Cariflex kit. Both great toenails. She got the kit as well, and then she also got a Lamisil booster at that appointment because she had already been previously on the Lamisil. Next patient was an orthotic follow-up. This patient had some kind of issues with the orthotics. They were painful for him, but I think the problem wasn't the orthotic. The problem was his foot. So, for example, if you give an orthotic to someone that has right heel pain and only the right side hurts, the problem isn't the orthotic, it's the foot. So I'm sending him to more PT to kind of work on that, and then I'm going to see him back after that and then see how his orthotics are doing. Next patient was a 32-year-old that was previously on terbinafine without success. I put this patient on diflucan, and I'm going to be seeing them back in about 6 months for that. So that was a higher level visit because of the medication management. Next patient was a fracture. This patient has a kind of almost like a stick fracture of the 5th metatarsal. It's kind of popping up a little bit, and almost like a spiral oblique that kind of popped up a little bit. There's a big gap in there. We're doing shockwave. This was shockwave number 4, I think it was. EPAT, yeah, and then I'm gonna see her back. So I'm gonna see her back in another month. So I've done it. It's starting to heal in. Closure around the fracture site, and I'm doing focused only for this one. Next patient was a 46-year-old. She had a pain to both of her heels. She did not want or couldn't afford shockwave, so we did bilateral cortisone injections. So with cortisone and with ultrasound, I'm trying to do a little bit less cortisone. So usually I do 3 cc's. I did 1.5 cc's in each heel. I think I can be a little bit more exact with the ultrasound, and I'm going to see her back in 6 weeks. Next patient was my model patient. This guy. He's a 67-year-old. He is getting ready for a 40-day pilgrimage, and he's going to be walking, I think it's about 10 miles a day or something like that. And he had some really bad posterior tibial tendinitis. He still has some swelling around the ankle, and we did 6 sessions. This is 6 of Shockwave. He's going to go on his pilgrimage, and I'm going to see him back after, but he is doing so much better since we did the Shockwave for him. Next patient was my orthotic number 1 patient. This is a 68-year-old man that's been dealing with shin splints for a long time. He has some pronation, so we made orthotics for him. Next patient was a 59-year-old. She had a fracture of the second metatarsal, and it's kind of healing in. She's here for a fracture follow-up, and she also has a lesion on the left heel. And so we got x-rays, and we did lesion destruction on that heel wart. The next patient was a new patient. Now this is a patient. I have a lot of these patients. She is a 28-year-old. She's a Brazilian. I don't know if you know, but my wife is Brazilian and I speak Portuguese, so I tend to get quite a few Brazilians. And they have a lot of these nail issues. I just think it's the Brazilian foot, I would say, the big toe anyway. They're kind of a wider nail, and they all tend to take, when they go to pedicure, they take out all the cuticle around the base and around the sides, and they're always digging out this. And so she had some like induration and hardness at the base of her hallux, medially and laterally. And they had been digging out the edge, but they couldn't really get out all of it. And so when I did a partial nail avulsion bilaterally on both gray toenails, on both edges of both gray toenails, and when I took it out, there's a lot of extra tissue in there, like callus formation, but also nail. And so I told her she may need a matrixectomy in the future. So she was a self-pay patient. Then that was the morning, and then the afternoon, there was a patient that had a fourth interspace, kind of web space maceration, so I debrided that ulcer there, and then there was cellulitis, so I prescribed him antibiotics. This is one of my favorite patients. He was in Strategic Coach for a number of years. He is an insurance salesman and a financial planner, and he has kind of a neat way of doing business, and he's like a go-getter. This is the guy that he said, I was talking to him about setting up like quarterly CME credits for primary care. So what he did is he set up CME courses for accountants, where he used to get accountants in a room and he used to do a lecture for them, and then that's where he got all of his referrals from. So he did this quarterly, and then all the accountants sent all their clients as for financial and insurance to him. So he was really smart about it. So I was thinking, well, can I set up something where I would do this for primary cares, whoever my referral sources are, get them in a room, lecture to them, maybe they can get CME for it. And he was going to teach me. And he was so great. He said, "Yeah, and I'll you pay me $15,000, and I'll teach you how to do it, and I'll help you do it." And I was thinking to myself, these guys are great. They're go-getters. They're this other dentist I told you about. He was going to charge me $1,500 a month, right, to coach me. But it just neat. I did not take him up on it. I still like the idea. And maybe it would make a dramatic change in my practice for referrals, but I'm just not ready for that yet. But I just wanted to share that. Next patient was orthotic number 2. This is a patient, 49-year-old, that had really bad calluses to the forefoot and the heel. He has quite a bit of equinus, so I had him work on the equinus. Otherwise, everything looks fine besides the high arched foot with the calluses, so we're going to do the orthotics and callus trimming. Next was a 6 of 6 shockwave, 6-week follow-up for him and an office visit. Just because it was the last shockwave, I always do office visit in the last shockwave. Next patient was a 21-year-old. I did a matrix bilaterally on him, no follow-up. Next patient was a 33-year-old, came in for posterior tibial tendon insertional pain in the navicular. I spent a lot of time with this guy, but he didn't do anything. I tend to find there are some patients, they just want information. And this was the same guy that on our website we have something where it's called a kind of a lunch and learn. So basically on the website, if they're interested, I'll meet with them from 12:30 to 1. There's I'll do a lecture. It's like a Zoom link that they can get, and then I'll answer his questions. So this guy, talked to him on that Zoom link. He came in. Thankfully, I was able to see him as a patient, did x-rays. But what he needs is shockwave for that, because it's kind of an analogous to any other tendon inserting into the bone that's inflamed, and he's kind of a runner doing 14 miles on the weekends and about 4 or 5 during the week. He's not really ready to do that, but that's what he needs because he has some pronation. He has that inflammation in that posterior tibial tendon insertion region. So he's going to come back as needed if he changes his mind. Next patient was shockwave number 4 out of 6. Next patient was she was a cute one. She was a 92-year-old, and she doesn't look 92, and she has this pain to the first metcuneiform joint. And I gave shoe recommendations, UFOs, things like that. I recommended orthotics. She said, "Sonny, I don't want to spend money on an orthotic." I was thinking to myself, you can't take the money with you. But she ended up doing a cortisone on her to the first metcuneiform joint region. Next was a patient that canceled, and then the last 2 were shockwaves, number 2 out of 6, and the other one was 4 out of 6. The one with 4 out of 6 was actually the navicular insertion, the tuberosity of the navicular as well. So that was the day. It was a good day, a lot of shockwave. And like I said, I looked at my numbers. I was kind of proud of the orthotic number, and also my shockwave number. I think it was like 54 or maybe 60 for last month as well in terms of patients that had shockwave. So if I guess if each of them get 6, it would have been 10 patients, but it sure felt like there was more during the month. Okay, we'll talk to you guys later.